Hello, everybody. I am Dr. Jinan Osta. I'm the president of WONCA EMR, and I would like to congratulate you and welcome you to this webinar, which is supposed to celebrate the World Family Doctors Day. It is this time of the year it's this time of the day each year that we celebrate the World Family Doctors Day. The theme of this year is first in, last out. It was inspired by the COVID pandemic, and it is meant to highlight the role of family doctors and the contributions they can make to primary care and the way they can fight, they can contribute to fight this pandemic. Now, we're having a very wide panelist. This is a very peculiar event because we're having most of the presidents or the representatives of Family Medicine Society in the EMRO region who are joining us in this event. So it is a celebration across the East Mediterranean region. We'll start today by the opening remark of Dr. Ahmad AlMandhari. We all know Dr. Ahmad AlMandhari. He is the WHO representative, RD, and above all, he is also a family physician. And we're very glad and honored to have this day to celebrate with us the Family Doctor Day. It is to note that Dr. AlMandhari will not be staying for the whole event because he has appointments. So he'll be staying for around 10 minutes after he's finished his speech. If anybody has a comment, please, you have enough time to present after he finishes. Dr. AlMandhari, please.
Bismillah ar-Rahman ar-Rahim. Assalamu alaikum wa rahmatullahi wa barakatuh. And good morning, good afternoon, and good evening, colleagues. Thank you very much, Dr. Ginan, for arranging this important meeting and very important discussion that is coming at a very critical timing in which we need all to, to come together and share ideas and share thoughts and experiences and bring suggestions together to deal, inshallah, successfully with this pandemic. It is my great pleasure and my great honor, to be in this discussion. And as you said, I apologize in advance for not being able to continue with you this important discussion because I have some other commitments, but inshallah I will follow it up with Salah about the outcome and the suggestions that you can bring us and in fact, implement and work together to fight this pandemic. We just, in fact, a few minutes back, concluded WHO 73rd WHO meeting, which we have done it for the first time in the history of WHO virtually. We are supposed to be nowadays in Geneva for about 2 weeks discussing different issues relevant to global health. But this time we managed to get it virtually, focusing on COVID pandemic operations for 1.5 days. So we just concluded a few minutes back. One of the key messages in that sort of meeting today and yesterday, one of the messages is in fact, partnership and working together to cope and fight successfully with this COVID-19 pandemic. And as part, of our vision here in EMRO, Vision 2023, Health for All, by all, a call for solidarity and action. It is the spirit that we will be working here in EMRO, collaborating and cooperating with a very strong, well-esteemed, organizations like WONCA. And we have been enjoying, in fact, this close and long-standing partnership with WONCA at global and at a regional level. And this is now very appropriate that we come together and mark the World Family Doctor Day for 2020 together, celebrating it together and sharing ideas. And as you all know, the role of family doctors, family medicine in general, but family doctors in specific, is never became vital than this moment and at this time, dealing with COVID-19 pandemic. Family physicians are at the front line with many other colleagues from other professions, nurses and allied healthcare professionals. dealing with patients, tracing them, searching for them, identifying the positive cases, providing whatever primary sort of measures, and before shifting them or moving them to the hospitals, dealing with their families and other individuals in the community, dealing with the fear that is strongly linked with this COVID-19 pandemic, let alone with the clinical services. Family practice, to me, must be at the central part of whatever healthcare system that each country try to create and develop to deal with this pandemic. The effective use of family practice can ensure that everyone is really getting a very trustful message, trustful information from very competent healthcare professionals, depending on reliable sources. This sort of commitment from family physicians will definitely have a very positive impact when it comes into reducing the load on the healthcare system in general, but when it comes into hospitals in specific, particularly when it comes into dealing with mild to moderate cases at a primary healthcare level, and leaving, if we can say, the severe cases or maybe few of moderate cases and definitely severe cases to be dealt at a hospital level. This will definitely save us lives, but as well as resources, to be directed to other needs, healthcare needs. Family physicians, as I said, they, yes, can successfully deal with the technical part, but also they will be able to deal with the non-technical part relevant to COVID-19. They can deal with awareness and raising the public educational level about how to deal successfully with COVID-19 pandemic, through teaching them whatever preventative measures that have been recommended by many organizations like the WHO. To make this sort of thing happening in a very comprehensive manner, we need, as we all know, that to work together with the 3 levels of the organization, and this has to be really reflected in the mind of the healthcare leaders, first of all, and decision makers, but as well as in the mind of our colleagues working in the 2 levels at the secondary and tertiary levels. Otherwise, the whole healthcare system will face difficulty without strong involvement of the family medicine system or our family medicine colleagues and practitioners. WHO has been working closely with many other organizations, including WONCA, to support countries by adopting a very comprehensive integrated approach. And together, as I said, with WONCA and many other organizations like UNAIDS, the UN Population Fund, the UN High Commissioner for Refugees, UNICEF, and many other UN agencies, we have developed a guidance for primary care policymakers and providers on the role of primary care during this pandemic. The guidance identified 4 main key areas or key rules for primary health care to deal with this pandemic. One of the first rule of primary health care or family physicians or family practitioners is ensuring the continuity of the care given to individuals and community members. And continue to here it means it is not only for COVID relevant services, but for many other services that unfortunately have been a bit ignored because we tend to focus our attention only to COVID-19 operations. And now I'm sure statistics, if we go to how many disabilities or deaths that are resulting from non-communicable diseases, from other risks relevant to health, I'm sure that the number is really frightening. So continuity is one of the important things that family physicians can really lead. The other component of this sort of document and guidance is the preventative measures that is fully supported by evidence-based medicine when it comes into public health measures. to be taken by members and individuals in the community, and that has been recommended by WHO. It is a package of public health measures like social distancing, following cleaning and protective measures when it comes into avoiding mass gatherings, wearing masks or wearing gloves or washing hands and cleaning, these sort of measures and activities. Also, the third one is the diagnostic part of COVID-19 cases and ensuring that a very efficient and effective referral system is being implemented at the country level. Otherwise, the hospitals will be overloaded with all COVID-19 positive cases. So the right diagnostic tool with the right referral system is created in the healthcare system in order to make sure that hospitals are not going to be overloaded. And the third point is when it comes into the management itself for mild and most of moderate cases, if not all of moderate cases, to be handled and taken care by the primary care level with the family physicians and family medicine doctors are available there. So these four main components are definitely very important. And online training have been, I think, is created and it is been introduced. But I'm sure Dr. Salah and your good self, Dr. Ghassan and Dr. Hassan, Ghassan, Ahmad and other colleagues will definitely add into the discussions. When it comes into the pandemic itself, again, it is very crucial to ensure that people everywhere to continue to receive other essential services, and this have been repeatedly mentioned in all of our discussions, either within WHO or between WHO and other agencies and ministries of health in the countries. Because of COVID-19, for the first few weeks of this pandemic, our attention have been more on it, ignoring services like immunization, like maternal and child health, like services given to patients suffering from other communicable diseases like diabetes, like HIV. And in fact, we have got some data and information reflecting on this, the negative impact of this sort of focus on COVID-19 only. And the other point, before I conclude, I would like to add is about, the fear that is there sometimes inside or within the community from this COVID-19, which leads them sometimes to following some non-evidence-based behaviors, like drinking some sort of disinfectants or some sort of herbs or this sort of information that are coming to them from here and there, especially with the social media, infodemics, as we say. And I'm sure here the role of family physicians is at the heart of educating the community members and giving them the right information. And to me, based on my limited experience working as a family physician, patients, their families, and the rest of the family, the community members, they trust us a lot when it comes into giving them the real full picture about any sort of disease, let alone this pandemic in which people are lacking a lot of information and they seek getting information from the reliable sources. My last comment is, I would like to thank all colleagues who are really working at the front line, the whole team, from nurses, physicians, all other colleagues working in the laboratories, the pharmacies, and other allied healthcare professionals and teams for their hard work and commitment. And in fact, we lost some of our colleagues in different countries here. They lost their life because they were at the front line, and they have given their life sacrifice, to save the lives of others. So we pray Allah to accept them and bless them. Thank you, Dr. Ghassan, again for inviting me, and I'm really very honored and pleased to be with you. And I'm sorry again, that I have to leave because of other commitments. And I'm looking forward to have this sort of strong collaboration as usual and partnership with WONCA and hearing from whatever suggestions that you would like to propose. And I assure you, inshallah, of our full commitment to work together. Jazakum Allah khairan. Thank you very much.
Thank you so much, Dr. AlMandhari. It was very nice, and looking forward for more collaborations together, for sure.
Inshallah.
Thank you, inshallah. Okay, thank you.
Thank you. Shukran jazalan.
Shukran lak. And now we're going to move for the second presentation, which is going to be by Dr. Ghassan Hamadeh from Lebanon. He's the chairman of Family Medicine Department and, at the AUB, and the representative of Lebanese Society of Family Medicine in WONCA Council. And he will be talking about the basics of telemedicine, because we all know that telemedicine is going to be part of the future of healthcare delivery. And he will be presenting about telemedicine in primary care. Dr. Ghassan Hamadeh, the floor is yours.
Thank you, Jinan. I hope you are hearing me well. If you can nod and say yes. Jinan Osta?
I can.
So I will be sharing with you a deck of slides that will be for maybe 15 minutes or so. These slides will be also shared with you later on. I think they have references. It's a collection I have made for this presentation. And as we know, everyone is talking about how tele everything is important. So we thought to share with you the basics of telemedicine, so to speak. And I have chosen this picture here that you can look at. It's from The Futurist. Every slide has its reference for you to use later on. If you look at this picture here, you see this drone bringing medications to this camp. And you look at this doctor taking care of this patient. The patient has a state-of-the-art, the Futurist cast, a different, special brand. The doctor has an ultrasound portable tool with her, taking an ultrasound. This is probably a family doctor in the field, taking an ultrasound of the elbow. This woman has fallen probably and has had her cast here. At the same time, this doctor is helped remotely by someone else using some sort of a pad, and is able to do maybe an IgG for corona. God knows what kind of test she is able to do. So technology is everywhere. And this is what we'll be sharing with you in the next slides. I'll be talking a little bit about caring from a distance. What are the modalities for caring from a distance? Share some misconceptions or common false conceptions about telemedicine. And we'll talk about whether we're ready for telemedicine or not. So basically, it's a general introduction, nothing very, very challenging. Caring from a distance is the word that we use is telephone, telemetry. The word tele means from afar. So you can have a telehealth, you can offer health services from afar, all kinds of services. And the telemedicine, which is individual particular patient care, not necessarily other health services beyond the caring for an individual person. So tele is nothing special, it's just remote, doing things from afar. And the other term that is important for most doctors, family doctors, lay people to know is the famous Internet of Things. And a thing means anything, a phone, a watch, a refrigerator, a toaster, the doorbell. All of these are now connected all together through the internet. And that's why they call it an Internet of Things. I have to get rid of these pictures. So the Internet of Things, because they're all connected. And that Internet of Things is what is making life so different. That is making it so easy to get information at all times from patients or non-patients, and so on. And this has been going on before COVID. We have seen the rise of telemedicine for a variety of reasons. Mostly the consumers' expectations are changing because now they're all connected, and because health insurance and governments think it may be a way to save money. So it satisfies the 3 or 4 dimensions of care that we often talk about. Now, what are the modalities of caring from far away? Caring from far away can be live, and we call that synchronous, or can be interrupted at intervals, and we call that asynchronous on the left-hand side. So an indirect or asynchronous non-live caring can be through teleradiology. You send x-rays from afar for someone else to read it. You send a picture of skin. You send an email. You do a message, and you wait for someone to respond to you. Or through mobile health can be indirect. We collect data on the fitness trackers, my diet, my exercise, my blood pressure, and so on remotely. And then I send them to the doctor. The doctor looks at them, or the healthcare worker or the nurse, they look at them at a later time. Or it can be synchronous, where everything happens at the same time through a telephone. So a telephone call is really telemedicine. A FaceTime, where you can have a video, you can see the person. A virtual consult or a virtual visit, and then as we go on, it gets more and more sophisticated, even with continuous monitoring of my heart rate, continuous monitoring of my height and weight, or my oxygen. So it can be direct or indirect. And this is where the misconceptions, people think that telemedicine is something new, it is something that has to be sophisticated. If you look at this picture here, this is a cover page of a magazine from the 1920s when the radio was invented. People put this doctor and caring for this person remotely. Interestingly, it is the model where there is a nurse assisting, and the prejudice, it's a female, shouldn't be a female, can be a male as well, taking notes with a doctor. Now we have EHR, you can dictate this, and then the notes can be taken. And then this doctor remotely taking care of this patient. So this is really, it has medicine through the radio, it is nothing new. It's been present for more than 100 years. The second thing is we always complain that it cannot include a physical exam. Well, a lot of decision making is done without an exam. More than 50% of diagnosis can be reached alone by history alone. And then if we want a physical exam is look, listen, and feel. We already have the look, dermatology, ophthalmology, orthopedics. We have the listening, the cardio, the respiratory collections, identification. We don't have the feel. And there is the issue of the healing touch that always comes in with family medicine, the dimension of rapport, and so on. So maybe there is a point there. It is not, at this stage, we cannot do all kinds of encounters, all kinds of caring, individual patient caring through remotely through tele approach. On all those slides that we'll be sharing with you, we have the references, so you can go and read more about particular articles of relevance or websites of relevance. So the healing touch. Sometimes we say it is not available, and others say, well, it is not bad after all. The phone call after a visit, post-op visit, so you're concerned about someone, you tell them to call me. That is some sort of telemedicine. You can video call me, so I can look at a wound, or I can look at a abrasion and see what it looks like after a visit. So it is important for patient relation. It maintains the patient relation. It would reduce unnecessary visit to follow up for something, or follow up or go to emergency room. It would certainly help to review medications for an elderly who cannot move or who cannot come to clinic. Another misconception is that patients do not like it. And then we know from at least this report where they have, how would you rate the virtual visit, a video visit? And you see that the majority in psychiatry, neurology, cardiology visit, they found that it is satisfactory and they like it. So virtual visits are not bad. A lot of people like them. So it is something, especially now with COVID, we're forced into doing that, and this is going to become more and more common. So are we ready, or have we been pushed into those telehealth, telemedicine, teleteaching, telecommunication, telemeeting? Well, COVID pushed us into this, and some countries were not ready. Countries who had poor bandwidth, they're suffering. You have the communication, it falls down, does not work. There is issue of education. Do you know how to use the tool? Do you know how to use the system, the software? When we first started doing these telemeetings, a lot of us did not know what Zoom was, what WebEx. So we had to train people on using them. It was a steep learning curve. So there was some blessing with the COVID that it pushed us into learning about these things, pushed governments into improving their communication, and so on. And leadership and legislation is another issue. And last is the availability of technology. So I need to do a telecom with a patient. He needs to have a phone. He needs to have, or she needs to have a computer. I need to be able to do this. There is education and technology. This is summarized by the acronym here, BELT, Bandwidth, Education, Leadership, and Technology. And this is in one of the textbooks of informatics. Now, if we are ready and you want to know if your country is ready, WHO publishes regularly and does surveys almost every year on various countries to see if they are ready for e-health. And they have a long checklist. And this is the link. You can go there and take a look what needs to be done at your country, what pressures can you do, or at the level of the government or at the level of healthcare industry to make it available for you. Now, I will address, besides country readiness and the BELT thinking, is what would you need, you as a physician, as a family doctor, assuming you have the tools, how can you customize your clinic, how can you customize your practice to offer the telehealth? First, you have to decide on what conditions you want to do through remotely, through a phone, through a FaceTime, through a Skype, through standardized or commercial tools. The most common diagnosis published here in family practice in 2015 are the ones you see on the screen. Follow-up for sinus, URI, cough, conjunctivitis. These are the common problems that we do in family medicine. A lot of them can be followed up. Either a patient can call you, a patient that you're familiar with, you're comfortable with. You can call them, or they can call you for this, or you see them in clinic and you call them later on after for a follow-up. So these are the common conditions that are done. Notice here that we have behavioral health and chronic condition, diabetes follow-up, hypertension follow-up, depression follow-up, anxiety. This is why psychiatry is on top of the list of specialties using the tele approach. So one is deciding what kind of conditions you like to care for remotely. Second, you have to think, there's a checklist. You have to think, do I want to do it using Skype? Do I want to use it using WhatsApp? Do I want to use it only by phone? Do I need to see the people? And then, are there any restrictions in the country on licensing? Are there any other vendors that can offer better than Skype or WebEx or Zoom to do it? Is there any way, what am I going to do without the visit? Am I going to ask the patients to pay? How are they going to pay? How private is the communication? How secure is it? Will someone be able to hack it and see what I have done? How will I document? How am I going to make prescriptions if I want to order lab tests? So these are like details you have to decide ahead of time on how you are going to do them in your practice or in your community. Now, if you live in wealthier countries like the US, for example, they already have a lot of vendors that provide answers for all these problems, the prescriptions, the follow-up, the licensing, the medications, and so on. In our part of the world, in the Near East, the first ever telemedicine conference just happened a couple of years ago last year in February 2019. And it was not in anticipation of COVID. I think with COVID, we have moved much faster. There are now many vendors in Egypt, in Jordan, that offer telemedicine opportunity for physicians where you can use them. Assuming you decide that you want to do telemedicine, you have to remember that you have to be ready, you yourself. What is your appearance? You want to look professional. You have to have a quiet room, proper cameras, proper audio, avoid backlighting, for example. You have to also train your patients. So ideally, what we've been doing, for example, here at the American University in Beirut, we have decided to first go with patients whom we have seen, we're familiar with. We tell them, you can contact me back using a video call. And make sure your phone is ready for this, your phone is secure, or if you want to use it in your computer, go to a specific website. And we give them instructions, you know, where they can sit down. This is derived from after the COVID-19 for an ENT service. So they're telling people like how the people who come to ENT, they're telling them, you have a flashlight ready. I want to be able to see your neck. If I ask you to show me your tongue or your throat, this is what I'd like you to do. This is how I do my nerve exam. So it's like a handout that the clinic gives for all their patients, telling them what to expect in a telehealth visit. The same thing with orthopedics. You know, they give them instructions what to dress and where to stand, how to show the knee, how to move, and so on. Important, the patient has to have a phone, has to have a tablet to be able to communicate with you, has to have internet access to communicate with you. So what I have done here is briefly show you, this is New England Journal of Medicine 2016, briefly showed you some ways to address the limitations of telemedicine. I have addressed some of the social issues, you know, the brand, national, the broadband, national issues that you have to face, communications, some of the clinical issues that you can examine your patients, educate them, prepare them for follow-up, issues of prescribing. But there are also other issues that I did not address that one has to really think of. And for example, here we have faced some challenges with reimbursement. Many people in our part of the universe do not think they should pay for answering a phone call. Insurance companies find this sometimes not exciting. But now with COVID, things are changing. Many insurance companies find this a way to save on visits. They think it may be worthwhile. Then you have to find how to charge. You charge with credit card, before, after. And the other issue are the legalities. Are you licensed to do healthcare by remote? What are the restrictions on prescribing by remote? Do we have electronic prescriptions available? So these are a lot of hurdles that COVID has helped us push to the forefront through legislation, through our societies, through our orders of physicians to resolve. Thank you very much. This is all what I have to share with you. I hope you have enjoyed it.
Thank you.
Thank you, Dr. Hamadeh, for this really enjoyable and insightful presentation. I will just address you one question, which was our comment probably that was mentioned in the chat box. And then we'll proceed and keep the other questions till the end for the discussion so that we have enough time to go on with the presentation, if you don't mind. The comment was about it's not only the country readiness, but also there should be some kind of readiness or acceptance from family physician. And the example of UK was quoted whereby there is the infrastructure, but family physicians or primary care physicians did not really accept it and they did not adopt it. So what do you say about this?
Yeah, this is why we presented three things: the country readiness, the provider readiness, and the patient readiness. So the country readiness requires the bandwidth, the legislation, the leadership, on the belt, the technology. So, but also we need the provider to be ready. Do they know how to do it? Are they willing to do it? It is not covering all the practices and so on. Of course, it's a major change management. Now we may be ready, the country may be ready, but certain patients would say like, I don't have a phone, or I really don't want, I want to come in and listen to you. And there are always specific situations where you definitely need to see the person to get a better assessment. So it is never an either or, it's a total package.
Okay. Thank you. I'm sure many of you have questions. Please keep them till the end. Now we'll go with the presentations, but I would like each president of the society, member representative, to please come forward, unmute your phone and present yourself to the audience so that they get to know you and then they can associate you with the videos that we're going to present. Now we'll start by alphabetical order. I don't know who is on, but let's start with Afghanistan. Do we have Afghanistan? No, seems. So we go by Iran. The representative of Iran, I saw him
Is Jinan
Yes.
and Dr. Kamiabi from Iran. Yeah, he is in the presentation right now. I think he has some difficulty in some, but
okay.
yeah,
Okay.
we will back to him. Yeah, we will back to him.
Yeah, we will be back to him. I missed Egypt. I'm sorry. So representation from Egypt, please.
Hello, everyone. It's Nagwa Nashat Hijazi, Associate Professor of Family Medicine. I'm representing Prof. Taglit Farhad, the Chairperson of the Egyptian Family Medicine Association. And also we have a video that had been prepared by Dr. Marwa Muhassib, our Razian Doctor Movement Chair. Happy Family Doctor Day, everyone.
Thank you. From Iraq? Muntadir. From Iraq? No, maybe in a while. Kuwait?
I'm Dr. Mariam Al-Gattan, Treasurer of the Medicine Society. Happy Family Doctors Day, everyone. Hope that we share our experiences here regarding COVID-19.
Hello. Jordan? Dr. Tarawne, Jordan? Okay. Lebanon?
Hello, Jinan. I am Ghassan Ahmadi, but I think we'll have someone else present a video.
Yes, we'll show the videos all together, but I thought people would like to get introduced to the member process.
How are you?
Mm-hmm. Okay. Jordan, Dr. Tarawne, would you like to introduce yourself? Dr. Tarawne? Muhammad Rasool? You have to unmute yourself.
Good evening, everybody. It's with a pleasure to share with you our presentation that had been submitted previously. And I want to congratulate all of you this happy Family Doctor Day. Wish you all of the best from my heart.
Thank you. Now I see Dr. Muntadir is back. So would you like to introduce yourself? He's the president of Iraq Society. Muntadir. You unmute yourself.
There's a problem.
Yes, he said he's muted. I'm telling him mute himself. Okay. Muntadir, is that you? Shall we move now to Morocco and then we'll get back to Iraq? Okay.
Hello. Yes, Fatem Zaran Shishalani. I am the president of AlMandhari from Morocco, and I am glad to be with you today. And I tell you, happy Family Day for all.
Mm-hmm. Okay. Oman?
Hello, everyone. I'm Abdulaziz Al-Mahrazi. I'm the president of Oman Family Medicine Society. And I wish you all happy Family Doctor Day. And thank you very much, Dr. Jinan, for organizing this event.
Thank you. Palestine? I'm not sure. I'm not sure they joined. Palestine, okay. And then Qatar? They didn't join. Okay, last time, Iran and Iraq. Anyone is still available or there? Oh, we have Pakistan is not in EMRO. I'm sorry. Okay. All right.
Pakistan is here. Yeah.
Yeah, but okay, Hina, if you feel like talking to everybody, but you're attendee. We'll now move
Okay.
to the yes. Iran or
On
Iraq?
behalf of
Yes.
Dr. Kamiabi, this is Farmat Rafi, and happy Family Doctors Day, and thank you, Jinan, for this webinar, and all success for all people and all colleagues in this day. Thank you.
Everyone, and I would like also to welcome Pakistan and Bahrain, who are part of the attendees and participating in this, but we don't have member representatives in our council, so hopefully next time we can have a common webinar with everyone. Now we'll move to the videos that each member organization has prepared about the achievements of family doctors in their own region. So, and we try to collate them all in one, going by alphabetic order. And please, Hassan, can we go over it? Thank you.
Hello, I'm Dr. Sino, family physician, on behalf of Afghan Family Medicine Association from Kabul, Afghanistan. First of all, please accept my sincere greeting. At meanwhile, happy 4th Family Doctor Day to dear Mr. Jinan, President of WONCA, EMRO, and all respected members. So far, total cases of COVID-19 in country is more than 4,000 cases, which 85% are active cases, 12% are recovered cases, and 2.8% are dead cases. Due to lack of accurate and reliable reporting system, the real number and statistics are more than done, which had been reported. Family medicine specialty established in 2005 in Cure International Hospital in Kabul. We have 79 family physicians, which unfortunately the first victim of COVID-19 was a family doctor, rest in peace, Dr. Anif. However, it was not the end of our efforts, and despite many challenges in front of health sector in the country, family doctors have considerable activities in 3 following aspects: and preventive and community measures, patient management, and participating in national conferences related to fight COVID-19. And preventive measures to increase public awareness regarding social distance, hygiene. Afghan family physicians was active in social media by publishing posts, distribution of informative brochures, and distribution of emergency food aid for needy people during country lockdown, and teaching of hospital staffs. In COVID-19 patients management, Afghan family physicians are initiated by serving voluntarily in Afghan Japan hospital, which is designed for COVID-19 patients. They are caring for critically COVID-19 patients, and besides that, we do counseling and caring for National Alliance to Fight COVID-19 conferences and workshops. In terms of this year, World Family Doctor Day, deemed first in, last out rule, we had begun fighting by losing of our talented and young doctor, and we will keep fighting till complete eradication of COVID-19 in country. It explicates that Afghan physicians, like their counterparts and all over the world, are gatekeeper in the fight against COVID-19. Thanks for your attention. Long life family medicine.
Hello everyone. This is an honor for us here in Egypt to share our experience in dealing with COVID-19 pandemic in the World Family Doctor Day on May 19th. Under the umbrella of WONCA EMR, Razi Young Doctor Movement, and the Egyptian Family Medicine Association. In the Egyptian primary healthcare settings, we are working on two dimensions, our patients and our healthcare providers. As regards our patient, a system of triage has been established to early identify those who have fever or respiratory symptoms according to the case definition of the World Health Organization for COVID-positive patients. We also have established a system for telehealth for assessing the patients to determine whether their conditions require immediate management to decrease unnecessary visits. Also, awareness messages have been delivered regularly to all attendants during their waiting time, either through posters, videos, or live educational sessions. As regards our healthcare providers, training sessions for appropriate use and disposal of personal protective equipment and appropriate steps for hand hygiene are being conducted regularly. Our facilities are regularly disinfected. Finally, the situation is really serious, so stay home, stay safe. Thank you.
به نام خدا و با سلام. اجازه میخوام قبل از هر چیز عرض ادب و احترام داشته باشم حضور ریاست محترم منطقه و همینطور رؤسای انجمن‌های منطقه مدیترانه شرقی سازمان جهانی پزشکی خانواده. صمیمانه تبریک عرض میکنم این روز بزرگ را حضور همه پزشکان عمومی و پزشکان خانواده گرانقدر و مسلماً انتخاب و گرامی داشته چنین روزی صرفاً یک تجلیل نمادین نبایستی باشه، فرصتی است برای ارزیابی و برای رصد نظام‌های سلامت و همینطور نقد حکومت‌ها در رویکردشون نسبت به این برنامه مترقی و جهانی. پاندمی کووید 19 به همه حکومت‌ها اثبات کرد و اونها رو در فکر فرو برد که اگر سرمایه گذاری عظیمی بکنن نسبت به سطح یک خدمات، سطح اول، قطعاً با استفاده از این ابزار میتوانند سواد سلامت مردم رو افزایش بدن، میتونن نگرانی های مردم رو با این ابزار کاهش بدن، میتونن غربالگری ها، تشخیص و درمان های تسهیل شده رو انجام بدهند و بدین ترتیب بتوانند بار بیماری ها رو در حوزه تخصصی و بیمارستانی کاهش بدن و این به رغم خسارت های جانی، اقتصادی و اجتماعی تجربه گرانقدری است. در کشور بنده هم قریب به 27 میلیون نفر از جمعیت روستایی و حدود 5 نفر از جمعیت شهری تحت پوشش برنامه پزشکی خانواده قرار دارند و نزدیک به 8000 نفر از همکاران بنده با این طرح در حال همکاری هستند. متاسفانه در این بحران ما نزدیک به 100 نفر از همکارانمون رو چه از جامعه پزشکی، پرستاری و چه کادر خدمات پشتیبانی از دست دادیم و شاید مهمترین علت اون هم پایمردی، ایثار و جانفشانی این عزیزان و تنها نگذاشتن مردم بود. پزشکان خانواده و پزشکان عمومی ما خوش درخشیدند. شعب انجمن به معنای واقعی ایثار کردند، بسته‌های حفاظتی رو سعی کردند به جامعه پزشکی برسونند، حتی بسته‌های معیشتی در این ارتباط تهیه کردند برای اون مردم و بیش از اون تجهیزاتی رو برای بیمارستان‌ها تهیه کردند و ارسال کردند با جمع‌آوری کمک‌های خیرین. انجمن پزشکان عمومی هم در این مورد فعالیت‌هایی کرد. شاید مهمترین فعالیت اون در ارتباط با آموزش مردمی بود و همینطور آموزش‌های تخصصی که با همکاری سازمان نظام پزشکی و جمعیت هلال احمر جمهوری اسلامی انجام شد. کار دیگرش بحث غربالگری مجازی جمعیتی بود. با الگوریتمی علمی و در سایتی تحت عنوان test.corona.ir چندین میلیون نفر از مردم رو غربالگری کرد که این موضوع مورد توجه دولت قرار گرفت و هم از الگوریتم و هم از این برنامه به طرز شایان توجهی استفاده کرد. در حوزه اجتماعی پویش مردمی مبارزه با کرونا رو ما راه اندازی کردیم که با کمک چیزی هلوش 70 انجمن پزشکی و غیر پزشکی و سازمان‌های مردمی در حوزه اجتماعی در حال برنامه ریزی هستیم. طبیعتاً فعالیت‌های بیشتری هم صورت گرفته که در 3 دقیقه من نمیتونم راجع به اونها صحبت بکنم، اما سخن آخرم این هست که پاندمی و ما اثبات کرد که مرزهای جغرافیایی کمرنگ شده، همبستگی جهانی بیشتر شده. این بیماری و همه‌گیری اون باعث شد همبستگی مردم و نوع و دوستی افزایش پیدا کنه. باعث شد گفتمان بین نظام‌های سلامت و پژوهشگران در سطح جهانی برقرار شده و به نظر میرسه میریم به سمت تلطیف دیپلماسی سیاسی. به هر حال این امیدواری برای بنده هست که در سال آینده بتوانیم تجربیاتی که در ارتباط با کرونا داریم به اشتراک بگذاریم و نفع خوبی در این ارتباط همه ما داشته باشیم. خیلی ممنون و متشکرم.
Assalamu alaikum. I am Dr. Muntadar Saad Jabir, President of the Iraqi Family Physician Society. On behalf of our society, on the occasion of the World Family Doctor Day, we would like to present our honest graduate and praise to all dearest colleagues and wish to them good health and happiness as they facing the pandemic coronavirus in the first line of our country. Besides this event to confirm our appeals to support and empower the family doctor with the hard work by providing all the available capabilities while performing their sacred duties. We assure our unceasing support to all colleagues in their professional and academic way by raising their voices to the relevant authorities, hoping to preserve and save the environment to help them for deliver great jobs. Finally, every year, and the family doctor all the best. Happy Family Doctor Day. Thank you.
بسم الله الرحمن الرحيم والصلاة والسلام على سيدنا محمد وعلى آله أجمعين. بداية تقبل الله طاعتكم بهذا الشهر الفضيل، وخصوصا ونحن في العشر الأواخر من هذا الشهر. معكم دكتورة هدى دويسان، رئيس كلية الرعاية الصحية الأولية ورئيس رابطة أطباء العائلة والممارسين العامين. بمناسبة يوم الطبيب العالمي والذي يصادف 19 مايو 2020، الكلية ورابطة تهنئ أطباء العائلة والممارسين العامين في بلدنا الحبيب الكويت، وكذلك جميع بلاد العالم. وكذلك التهنئة تشمل جميع الطواقم العاملة في وزارة الصحة والمستشفيات والمراكز الرعاية الصحية الأولية العامة منها والخاصة، ونتمنى للجميع الصحة والعافية.
بسم الله الرحمن الرحيم. معاكم الدكتورة دينا جاسم طبيب، رئيس مركز علي محمد الثنيان الغانم الصحي ومدير برنامج التدريبي لطب العائلة. يسعدني في هذا اليوم اللي صادف يوم طبيب العائلة أني أشارككم بعض الكلمات. في هذه الأيام نواجه متغيرات جسيمة في مواقع العمل، ونتحمل أعباء ومسؤوليات جديدة لم نتعهدها من قبل، بالإضافة إلى ضغوط التعايش مع التوتر والقلق ومجابهة المجهول. ولكن عندما أفكر بأطباء العائلة ومنتسبي البورد الكويتي كيف واجهوا تلك التحديات والصعاب، أشعر صراحة بالفخر والاعتزاز. هذه الظروف الاستثنائية هي فرصة للارتقاء وتطوير المهارات للاستمرار بتقديم الخدمات الطبية للمجتمع على أعلى المستويات. ومن هذا المنطلق وفي يومكم العالمي أحب أشكر كل أطباء العائلة على جهودهم العظيمة في جميع الميادين.
Hello, I'm Dr. Ghassan Bennai, Consultant Family Physician, Head of Cordoba Clinic, and Assistant Director of Kuwait Family Medicine Board. The emergence of COVID-19 cases coincided with the celebrations of National and Liberation Day in Kuwait. On the first day back to work, we had our plan ready. A triage system was implemented for the first time in primary care. An isolation room for suspected cases of COVID-19 and a respiratory clinic were established. Designated staff wore their PPE, all other staff wore face masks. The clinic previously established a WhatsApp number for patients' inquiries. This now became the clinic's hotline for medical consultations. Other clinics established virtual consultations. Also, with the help of local volunteers, we offered home delivery for medications for those with chronic diseases as well as elderly patients. With a determined team, we are ready to fight coronavirus.
معكم دكتور عليا صادق، استشاري طب عائلة، ترينر وإكزامينر برنامج طب العائلة. من 25/3 بلشت تجربتي بمحجر الكوت، وبما أن الفريق الطبي كله أطباء عائلة وعندهم المهارات الإدارية والكلينيكية الكافية، بدينا نحط الآليات للعمل بالمحجر. أول آلية كان تجهيز عيادة من الصفر بغرفة فندق. وفرنا الأجهزة المطلوبة، جهزنا ملفات خاصة بالنزلاء واللي كان أغلبهم رادين من العلاج بالخارج. انتقلنا من مرحلة البيبر وورك للبيبرلس. بعدها حطينا آلية للأدمشن والديسشارج للنزلاء بطريقة آمنة وسريعة. لحماية الفريق الطبي اعتمدنا على الفون كونسلتيشن للنزلاء، وكان العمل بالعيادة على مدار 24 ساعة. فريق المحجر متطوعين، تمريض، طوارئ طبية، داخلية، كان يعملون على مدار 24 ساعة لراحة النزلاء. خلاصة تجربتي، أنا فخورة كمدربة ببرنامج طب العائلة أني أشوف ثمار جهودنا بتخريج أطباء مميزين كان لهم بصمة بكل الفرق التطوعية لمحاربة الكورونا.
Hello, I hope you're doing well and keeping safe. My name is Mona Osman and I will be presenting on behalf of the Lebanese Society of Family Medicine, led by Dr. Ghassan Hamadeh. I would like first to wish you a happy World Family Doctor Day. I will be discussing briefly the role that our family doctors are playing during this pandemic. So our story in the country with COVID-19 started in February, where the first case was diagnosed on February 21st, and so far we have 931 diagnosed cases. We're still in level 3 of transmission, and the lockdown measures were eased and decreased starting May 18th by the government after more than 2 months of strict lockdown. Hopefully things will remain under control with the COVID-19. So our family doctors have been active, whether with patients, whether in the community. So at the level of the patient care, they continued providing medical services, whether in private clinics, emergency rooms, or primary healthcare centers. This was done for urgent cases most of the times to avoid exposure, and many institutions also started implementing online consultations, online clinical consultations. Many doctors were also involved in raising awareness, educating the community on preventive measures to decrease COVID-19, and at the same time raising the awareness for healthcare workers on how to protect themselves. This was done through different channels, whether media, TV, radio, or social media, Twitter, Facebook, and others. An important activity that family doctors were involved in also was participating in the COVID-19 or flu clinics that were established in some institutions in Lebanon. An example is in the military hospital, and another example is at the American University of Beirut Flu Clinic, where family medicine faculty members and residents were involved in evaluating patients presenting with symptoms suggestive of COVID-19, as well as conducting the PCR screening. Many family doctors also were members of the health committees in the municipalities, and they worked with these municipalities to raise awareness and to manage isolation measures and decrease exposure at the level of the community. In addition, the Lebanese Society of Family Medicine developed a guide to support municipalities in dealing with this pandemic. In addition to that, we created a WhatsApp group for the members of the society, where sharing updates on COVID-19 as well as individual experiences is being done. And some of our doctors are working on raising awareness on reproductive health as well as gender-based violence during this time period. I would like to thank you at the end and wishing you again a happy World Family Doctor Day.
Hi, Fatim Zahra Mshish Alami, Moroccan Private General Practitioner and President of MG Maroc, the National Collective of Moroccan General Practitioners. Like all family doctors around the world, we take care of our patients in many ways, through consultations, home visits, by listening to them, by practicing prevention, and by giving them advices. During the pandemic, we take care of our patients and we follow chronic cases, particularly during the religious month of Ramadan, which requires fasting, while still accommodating acute pathologies. But our attention is particularly focused on screening potential cases of COVID-19 that we direct to centers specialized in diagnosis and management of this pathology. In our office, we regularly sanitize the premises and provide patients with protective means such as disinfectants for shoes and hand washing, hydroalcoholic gels, and medical masks for those not wearing any. It is to be noted that medical masks are made available to very low and subsidized prices in grocery stores and pharmacy. We manage on a regular basis the psychology side effects of the pandemic. We also remain available to our patients via telephone, WhatsApp, and etc. Some private general practitioners and some retired doctors have volunteered to help in public hospitals. During this pandemic, our association MG Maroc organizes for doctors online seminars and conferences on various pathologies, including chronic pathologies, pathologies related to Ramadan, as well as subjects about COVID-19. For the general public, we have produced informational posts and conferences with the participation of municipalities on the means of protection against COVID-19, on pathologies related to Ramadan, on chronic diseases including diabetes, and among other things. A spontaneous solidarity emerged between doctors, government bodies, NGOs, and public. So, congratulations to all family doctors around the world for your contribution during this pandemic. Ramadan Mubarak and happy Family Doctor Day. Heureuse journée du médecin de famille. يوم سعيد للطبيب.
بتاريخ 31 من شهر ديسمبر من عام 2019 أعلنت جمهورية الصين لمنظمة الصحة العالمية وجود إصابات من فيروس مستجد في مدينة يوهان الصينية. بدأ العالم يستنفر لمرحلة جديدة من التحديات الصحية، وأمست الدول تراقب عن كثب ازدياد الإصابات والوفيات في مختلف بقاع العالم بلا استثناء. ولم تكن سلطنة عمان في معزل عن هذا الوباء، فلقد كانت كالكثير من الدول المجاورة سباقة في بحث آليات التعامل مع التطورات الناتجة عن فيروس كورونا المستجد للحد من تأثيرات انتشاره على المجتمع، وذلك من خلال الإشراف المباشر لعاهل البلاد المفدى وتشكيل لجنة عليا تتولى اتخاذ القرارات المصيرية المتعلقة بهذا الشأن. وفي خضم هذه الأحداث برز دور الرعاية الصحية الأولية في السلطنة ممثلا بطب الأسرة في المراكز والمجمعات الصحية، كونها الخط الأول في سلم الرعاية الصحية في البلاد. فلقد كان دورها ملموسا في مناقشة الحيثيات ووضع الخطط وتحليل البيانات وعرضها على المختصين لاتخاذ القرارات المناسبة لكل مرحلة. ومع إعلان منظمة الصحة العالمية هذا الفيروس كوباء عالمي بتاريخ 12 من مارس من عام 2020، أصبحت كل المراكز الصحية وعيادات طب الأسرة تعمل كخلية نحل لساعات طويلة استعدادا لهذا الضيف الثقيل. فبدأت بتطبيق قوانين الحماية من العدوى في كل مؤسساتها وتطبيق التباعد الاجتماعي لمرضاها وموظفيها، وقد قام أطباء الأسرة أيضا بالتعاون مع فريق مكافحة العدوى بتدريب جميع العاملين من أطباء وممرضين وفنيين في هذه المؤسسات الصحية على خطوات تعقيم اليدين وتطبيق جميع الإجراءات الاحترازية أثناء معاينة المرضى المشتبه إصابتهم بهذا الفيروس. فدور طبيب الأسرة يبدأ من اللحظة التي يدخل فيها المريض للمؤسسة الصحية، وذلك من خلال أخذ معلومات المريض والتاريخ المرضي وفحص المريض سريريا وإجراء المسحة بالطريقة الصحيحة، ومن ثم صرف العلاج المناسب له. ولا يقتصر دور طبيب الأسرة على هذا الجانب فحسب، بل ويتعداه إلى الكثير من الأعمال الأخرى التي يحتاج فيها الطبيب لمتابعة مرضاه المصابين بالفيروس عن طريق الهاتف، وتتبع جميع الحالات المخالطة لهم، والاتصال بهم ومعاينتهم، وإرسال طاقم طبي لهم إلى المنزل إذا استدعى الأمر. كما لا يخفى دور أطباء الأسرة في متابعة المؤسسات الصحية الخاصة والوقوف على جاهزيتها في استقبال الحالات المشتبه بإصابتها وتسهيل كافة الإمكانيات للقيام بالدور المنوط على أفضل وجه. وحين أصبح الوباء نقطة حوار ساخنة لجميع أفراد المجتمع، كان ظهور أطباء الأسرة جليا في وسائل الإعلام المختلفة كالتلفاز والإذاعة وجميع وسائل التواصل الاجتماعي، وذلك للحديث عن مستجدات الجائحة ونشر المعلومة الطبية الصحيحة ودحض الشائعات. وقد حرص أطباء الأسرة على تبادل الخبرات والنقاشات العلمية عن طريق عقد اجتماعات وحلقات تعليمية إلكترونية لجميع الأطباء العاملين في الرعاية الصحية الأولية، وذلك إيمانا منهم بضرورة تبادل المعلومات ومناقشة آخر مستجدات الأبحاث العلمية في هذا الصدد. إن المتأمل في المنظومة الصحية في السلطنة أثناء الجائحة يدرك يقينا كم المسؤولية الملقاة على عاتق طبيب الأسرة ومدى نجاحه في التصدي لها، وهو بلا شك الركيزة الأساسية للرقي بجودة الرعاية الصحية الأولية.
جميعنا حريصين على سلامة المرضى اللي في الداخل وعلى سلامة الطوافل.
واسرج ليلك واصنع من العز حكاييك، خليك شامخ على جبينك وارفع على قدسك رايك. اسرج ليلك واسرج ليلك واصنع من العز حكاييك، خليك شامخ على جبينك وارفع على قدسك رايك.
يا معجزة السماء ويا سيدة الأرض، بلادنا المكرمة بالمفخرة والمجد.
بسم الله الرحمن الرحيم. أنا الدكتور محمد ربعي، أخصائي طب الأسرة ورئيس جمعية طب الأسرة في فلسطين ومدير المركز الوطني للتأهيل مركز علاج كورونا. منذ انتشار فيروس كورونا في العالم بدأت دولة فلسطين باتخاذ مجموعة إجراءات لتفادي انتشار هذا الوباء. وقبل ظهور الفيروس بشكل رسمي أغلقت وزارة الداخلية الفلسطينية مجموعة من المطاعم والمقاهي التي دخلها مجموعة من السياح الكوريين بعد أن تم إعلان إصابتهم بالفيروس. وفي 5 آذار تم إعلان بشكل رسمي أول تسجيل 7 حالات لمصابين بفيروس كورونا في منطقة بيت لحم بعد مخالطتهم بالسياح اليونانيين. توالت الإصابات وانتشر المرض يصل اليوم العدد إلى الحالات المسجلة 548 حالة، تعافى منها 426 وتوفي 4 حالات. وكان لأطباء طب الأسرة دور كبير في هذه الجائحة، حيث أنهم تقدموا الصفوف وكان لهم دور ريادي في إدارة المراكز العلاجية ومراكز الحجر ومراكز الفحص، وكان لهم دور أساسي في وضع السياسات والبروتوكولات الصحية الخاصة بعلاج كورونا والبروتوكولات الخاصة بإخراج المرضى وعملية التعامل مع المرضى. كان لهم دور ريادي في قيادة وإدارة المراكز الصحية ومراكز العلاج ومراكز الفحص الاستقصائي، وكان لهم دور كبير في مراكز الفحص والتقصي، حيث شاركوا بشكل كبير في سحب عينات من مختلف المناطق ومن المرضى والمخالطين. كان لهم دور كبير في التثقيف الصحي والتثقيف والإرشاد النفسي، وكان لهم دور كبير في الدعم النفسي للمرضى المصابين، وكان لهم دور كبير في محاربة التنمر الإعلامي.
مؤسسة الرعاية الصحية الأولية، الخطوة الأولى لصحة عائلتك.
نحن أطباء الأسرة نعمل كتفاً بكتف مع زملائنا الأطباء في جميع التخصصات للكشف والتقصي عن حالات كوفيد-19 بالإضافة للحد من الآثار المترتبة لهذا الوباء.
قام أطباء الأسرة بلعب دور مهم في هذه الأزمة من خلال توفير الدعم المعنوي والنفسي إلى جانب اهتمام بالجوانب الصحية الأخرى، كما أنهم يقومون بلعب دور مهم في فهم طبيعة هذا المرض من خلال القيام بالأبحاث الطبية اللازمة.
يلعب أطباء الأسرة دورا رئيسيا في إدارة تفشي الوباء ودورا محوريا، فهم أول من يحضر وآخر من يغادر، وغالبا ما يكون أطباء الأسرة أول من يتواصل مع المريض.
أظهرت الجائحة الدور المركزي للقطاع الصحي وبالأخص لأطباء الأسرة مما لعبوه من دور جوهري للتصدي لهذه الجائحة.
مؤسسة الرعاية الصحية الأولية، الخطوة الأولى لصحة عائلتك.
We still have one more video from Jordan. It was difficult to download There was problem downloading. Now we're going to have it in 10 minutes. It's 10 seconds. Okay. Okay.
Dear colleagues, ladies and gentlemen, good afternoon. Ramadan Mubarak. I would like to thank WONCA for organizing this webinar on the occasion of World Family Doctor Day. At the same time, I want to send my sincere gratitude and congratulations to all family physicians around the world. It is with great pleasure that Jordan Society of Family Medicine joins WONCA member in celebrating World Family Doctor Day. This occasion is a wonderful opportunity to acknowledge the crucial role of Jordanian family doctors in healthcare system in general and during COVID-19 crisis in particular. They really have a first in, last out role. As always, they stand in the forefront and they are very important coordinators of primary healthcare teams. Since the early days of COVID-19 crisis, family doctors played a very pivotal role. They were the suitable and wisdom choice to provide care to thousands of Jordanians quarantined in hotels. Basically, because family doctors are well trained in the management of acute and chronic cases. Also, they provided instruction to quarantined citizens regarding infection control. Family physicians led the teams of early detection and case finding, contact tracing. During the country lockdown, family doctors who were working in Ministry of Health continued to provide care to patients of chronic disease through 24-hour hotline, Ask Your Doctor, and by delivering medicines to patients in their homes. They reached their patients in need through innovative ways of practice, new modes of practice, such as the use of internet and digital health. So digital and online video consultations were run using Zoom and some platforms like Tibcan and Visit. They continue to provide reproductive health, family planning, mental health counseling by e-health tools and through the tools that provided and submitted by the National Hakim electronic records. Shouts and applause are ringing out in many lockdown cities in Jordan, and social media is being flooded with messages of support for those braving the outbreak to help others. Not all heroes wear capes. In the midst of the COVID-19 pandemic, the real heroes wear scrubs. My passion for family medicine is personal as well as professional. Always proud of Jordanian family doctors. Congratulations to all. Thank you very much.
السلام عليكم ورحمة الله وبركاته. دكتور وسام الماوردي، رئيس الرابطة السورية لطب الأسرة. رمضان كريم، كل سنة وانتم بخير. ننقل تحيات كافة أطباء الأسرة والأطباء العامين في الجمهورية العربية السورية لكل زملائنا في من اختصاص طب الأسرة في العالم العربي والعالمي، وبنقول لهم كل عام وانتم بخير بمناسبة يوم طبيب الأسرة. نتمنى العافية والسلامة للجميع في ظل مكافحة هذا الوباء، وباء الكورونا. نحن في الجمهورية العربية السورية عملنا إجراءات احترازية مشددة منذ بدء الإعلان عن الوباء بالعالم. طبعا طبيب الأسرة كان شريك لأطباء والزملاء العاملين في القطاع الصحي تحت إشراف وزارة الصحة ومتابعة شخصية وحثيثة جدا من الجاهزية في وزارة الصحة ومن السيد وزير الصحة مشكور. كنا موجودين كلياتنا بالمشافي بالمراكز الصحية بفرق التقصي الوبائي بفرق الترصد وببعضنا بمشافينا أو بأقسام العزل والعلاج أو بالمتابعة بأقسام بأماكن الحجر ومتابعة الوافدين على الحدود بالأماكن الموجودة فيها الانتشار للوباء. بكلمة مختصرة، أطباء الأسرة حاضرين في كل مكان، في كل فريق يعمل على الأرض في الجمهورية العربية السورية. شكر كبير وجزيل للسيد وزير الصحة ولوزارة الصحة كاملة لكل المجهودات اللي قدمتها خلال الفترة الماضية، من دعم لوجستي، من توجيهات عملية، من توجيهات علمية، من إجراءات احترازية مشددة، من احتضان الكادر الطبي وتأمين وسائل الحماية والوقاية الفردية لكل العاملين الصحيين على أرض الجمهورية العربية السورية، وأيضا من التعليم اللي كان موجود خلال الفترة الماضية وتدريب الكوادر على كيفية التعامل مع هذا الوباء، سواء في النقاط الحدودية، سواء في المطارات، أو سواء في القطاعات الصحية أو المؤسسات الصحية كافة. بنقول كل عام وأطبائنا كلهم بخير، وكل عام وكل زملائنا بألف خير، ويعطيكم ألف عافية وموفقين.
Thank you all for these nice videos and presentations. We feel proud to be family doctors, and we feel more encouraged to do more and more. Now it's about time. I really thank you all for being here. I just would like to give the last chance for Dr. Saad to present himself to the panelists, to the audience, if he's still around. Are you still around? Okay. Any of the panelists has the last comment to make, or any idea to present?
Doctora, there were questions regarding legal consequences and difference between real exam and telemedicine that we have not addressed very well. I think legal is the main issue that we have faced, for example, in Lebanon, or in the US, they face for malpractice, getting a license and documentation. We have our order of physicians has requested that we do not prescribe anything on the phone or otherwise by video. So this is something you have to work on. Every country with the order of physicians they have to change these habits. I think now because of COVID, the general mood is ready to accept this change. Prescribing, مثلا, we have to write down a piece of paper and sign it on triplicate. It's a nightmare. So what we do, for example, is we tell the patient, come in at your convenience and pick up the prescriptions if they need a prescription. So these are the frustrating things. Yeah, legal is a major issue that has to be worked out. Real exam versus telehealth. One of the nicest, I sent you if you look at the slides, there's a link to one of the orthopedic telehealth services where they describe how to do, and they have videos. In fact, online, you can go on one of the telehealth provider. They show you how to do all the orthopedic tests, orthopedic exams using online. So how you instruct the patient what to wear, how to stand, and how to do things. So, but of course, it has always been an issue that certain things you need human interaction, and it's a challenge.
Thank you. I'm not able to see all the questions. If you have more questions addressed to you, would you like to?
Yeah, I think I covered all of them.
Okay. All right, but anyway, it's almost 6:30, and I appreciate everybody's participation and contribution. It is iftar time in some parts of this region, and I'm really happy we had good attendance and good feedback. Hopefully we'll be able to organize more webinars and involve everybody in this activity. Now I would like to close with the last PowerPoint slide, Hussein, if possible, which is a greeting to all doctors. It is written by, okay. It is written by Dr. Nabil Kenan, who is a family physician, and he is, I'm not able to move, okay.
You want to read it in Arabic? It rhymes, or you can, someone can translate. It's funny.
Yeah, I thought of translating, but then I saw it will lose rhyme. So I'm going to read it in Arabic now. طبيب الأسرة فنان يعرف أسرار الإنسان. طفلاً كان أم شيباً، امرأة رجلاً سيان. يمزج معرفة الطب والمجتمعات في آن. يرفع شأن الوقاية أهملت عبر الأزمان. ينصت إنصاتاً جماً. يعطي وقتاً للشبان. كبار السن ملجأهم للصحة لهم عنوان. بسمته لا تبرحه. هاتفه دوماً رنان. لا يعالج أعضاءً بل امرأً ضمن السكان. وإذ تفتح بيئة شاملة تغزو البلدان لبى الواجب ليغلبها لا يأبه دفع الأثمان. طبيب الأسرة إنسان للصحة خير ربان. Happy World Family Doctor Day. Thank you all for participating and hope to see you in other webinars. Bye-bye.